into the room, so I think we're going to go ahead and get started. I want to say good afternoon and welcome to everyone who is joining us today. My name is Dawn Ramsberg, and I am the Division Director for Program Operations in the Office of Child Care. And I'm going to moderate our tribal consultation session today. And so before we jump into the consultation itself and hear from our speakers, to kick us off, I'm going to go over a few housekeeping items at first. And so if you all can begin by typing your name and your tribal affiliation into the chat box, and you should see at the bottom of the screen, there should be a place where it says chat, and then you should be able to type in your name and your tribal affiliation. That would be great as we get started. In addition, I want to say a welcome to tribes who are joining us who have consolidated CCDF into the Public Law 102477 initiative. We're glad that you are able to join us today, and we recognize that while 477 tribes don't submit CCDF plans, you do address CCDF program requirements through your consolidated 477 plan. So we do look forward to your feedback and comments as well. And so we're happy you're able to join us today. I think I want to make sure that we don't need to switch to a next slide as I'm talking. So I have a couple more housekeeping things. So first or next, I want to let everyone know that the audio portion of the consultation is being recorded, and that's to help us with the transcription. If you prefer to share information without being recorded, you may submit written comments to us, and the email address for that is occtribal@acf.hhs.gov. And so again, we will have that available to you to share, but it is possible to submit written comments again if you would prefer not to speak during the recorded session today. I want to just make sure we go to the next slide because I think some of this is on that I'm reading is on the slide. So if we can go to slide 3. Thanks. Another housekeeping item that I want to share is, again, if you are speaking, we ask that you state your name just so we have that for the record. We want to make sure that not only are we taking your feedback and comments, but that we know who the representatives are. That way, if there is any follow-up that we need to do, that we're able to do that. In terms of the protocol for tribal leaders, again, we're holding this tribal consultation with the tribal leaders across the country. And so both the tribal leaders or their designee have been invited to attend today. And those leaders are invited to provide testimony using the following speaker protocol. So the tribal president, chairperson, or governor, followed by the tribal vice president, vice chair, or lieutenant governor, elected or appointed tribal officials, or designated tribal officials. So we want to make sure that, you know, as we provide testimony and as we hear from you, that we're aware in terms of the leadership that is speaking. If we can go to the next slide, just a couple more housekeeping items here. So if for some reason you need technical support during the consultation, and if you want to either take a picture of this or write it down, you can reach our technical support via phone, and the phone number is up on the screen. In addition, you can also reach the support via email, and so the email address is on the screen as well. And then if we can go to the next slide, kind of one more logistical housekeeping item here today. So there are a series of buttons that you should see via Zoom, and so the buttons are typically at the bottom of the screen. So you have the ability to mute or unmute yourself. So that button is on the bottom left. You also can use your phone and press *6 to unmute. In terms of viewing the screen, there's a button in the upper right-hand corner of the screen, and it allows you to view the speaker. So rather than looking at the whole tile of everyone who may have their video on, if you use speaker view, you will be able to see that speaker if you put the Zoom in speaker view only. In terms of participating, there's an option to raise your hand. So again, there is a button, a blue button that says raise hand, and it's over on the right-hand side of your screen. For me, it's showing up at the bottom of the participant list. So you're able to raise your hand, and that would let us know to be able to call on you. There's also a way to say yes or no, and those two buttons are to the right of the raise hand button. So if a question is being asked and you want to be able to answer either yes or no, that is there's a button for that as well. And then finally, and I've been watching all of your chats come in and trying not to be distracted while I'm talking, while watching your chats come in, but there's a chat feature at the bottom of the screen. And so it looks like many of you have found that already and have been chatting in your name. And so we really appreciate you all using that. Doing these virtually, there's a lot of screens and buttons to watch on the computer, as well as trying to listen and be able to talk with you all. So I am glad that that you all are finding all of the buttons and able to make this as engaging as possible, since we're not all in a room together. And so with all of that housekeeping, if we can go to the next slide, I am going to introduce the first of our officials that it's going to be talking to us today. And so I am pleased to introduce Katie Ham, who is our Deputy Assistant Secretary for Early Childhood Development. Katie joined the Administration for Children and Families at HHS in February of 2021. Before joining the Biden administration, Ms. Ham was the Vice President for Early Childhood Policy at the Center for American Progress, where she oversaw the organization's early childhood program to advance childcare, preschool, Head Start, and home visiting. And so with that, tribal leaders and honored guests, I'm pleased to introduce Katie Ham.
Thank you so much, Dawn. It's really a pleasure to be with you all today. As Dawn said, I'm Katie Ham. I'm the Deputy Assistant Secretary for Early Childhood Development. I am joining you today from Washington, D.C. and the traditional land of the Anacostan, Piscataway, and Nacotchtank people. I'm going to be introducing folks who are joining us from the administration today. And we are really just pleased to have a great lineup of people who support the Biden administration's vision and commitment to holding up the U.S.'s trust responsibility to tribal nations, strengthening the nation-to-nation relationship between the United States and Indian tribes, and working to empower tribal nations to govern their own communities and make their own decisions. Junyoung Chang, the acting assistant secretary, was supposed to join us today. Unfortunately, she is in a cell phone dead spot and hasn't been able to connect. But she did send some talking points to me earlier today and wanted me to express to you that she is very sorry that she's not able to be here today. We will be briefing her later on the comments and the feedback that are expressed here today so that she can have a sense of the conversation and understanding as we move forward with this process. But she did say that, as she thinks about the 2023-2025 tribal preprint, she's looking forward to hearing the feedback, is very grateful to you all for taking the time to talk to us today. And I think on behalf of ACF leadership, we wanted to just acknowledge that it has been a difficult year for Indian country with the COVID-19 pandemic. While facing these challenges, we've also seen the largest investment in tribal childcare over the past year to recognize these difficulties. Since March of 2020, tribal CCDF funding has increased to an additional $1.2 billion in supplemental tribal CCDF funds for responding to the needs of the pandemic. We are hopeful that these resources can alleviate some of the difficulties faced in childcare by providing resources to tribal childcare programs, mental health services to children and childcare providers in those settings who might need additional resources to recover from the pandemic. And we're looking forward to talking to you more about how those resources can be supported in the coming weeks and months. But today we're glad to have this opportunity to hear from you as we prepare for the next tribal plan submission process. This is, as you know, is the federal application you will use to apply for the CCDF funds, and where you will share your story of how the CCDF funds will be used to support the tribe's childcare program. We've been supporting a lot of tribal consultation events as part of the president's commitment to tribes. And hearing from you, not only on childcare, but on other programs has really helped us shape how we can be more responsive to the needs that you and your communities are facing. So again, just want to express on behalf of myself and Ju that we're really grateful that you all take the time to help us when it comes to formulating how CCDF and other programs within ACF support tribes. Right now, I want to introduce Libby Washburn, who's the Special Assistant to the President in the Domestic Policy Council at the White House. Prior to joining the Biden-Harris administration, Libby served in senior leadership roles at New Mexico State University and the University of New Mexico, focusing on building compliance structures and strengthening ethics requirements and the Title IX process. Previously, she worked in the Obama-Biden administration at the U.S. Department of the Interior. Ms. Washburn worked for Senator Jeff Bingaman, serving as both the state director and legislative counsel. And she practiced Native American law for several years for the federal government and in private practice. Libby graduated from the University of Oklahoma and the University of New Mexico School of Law, and she is a citizen of the Chickasaw Nation of Oklahoma. So I am very honored to introduce you to Libby Washburn. Libby?
Thank you. Thank you, Katie. Thank you for allowing me to be here. Welcome, everybody. I am happy to have such a great turnout at this consultation. My name is Libby Washburn. I am, as Katie said, the Special Assistant to the President for Native Affairs in the Domestic Policy Council. I'm a citizen of the Chickasaw Nation and joined the administration on January 20th and have been working to strengthen consultation throughout the entire federal government. So I'm thrilled that we're here today at this consultation. I hope that you are finding them meaningful and that you are being consulted regularly and that you're able to put forward what you want to see, what you want to hear. It's definitely a goal of this administration to make consultation real and meaningful. And so thank you for including me in this. Also, the topic is of great excitement to me. We have put historic investments in childcare through the American Rescue Plan. We hope to continue to put more funding in. And so we want to make sure that we're doing it right and we're doing it in a way that you can spend it and that it makes sense. And so hopefully that will come out in the consultation today, in future consultations. And we really are committed to strengthening this and putting real money towards this important issue. It is something that we'd love to see tribes build more capacity in. And so, I welcome any comments on that line too. I know you're talking about very technical things here today, but I also welcome tribes reaching out to me directly to talk about other fixes that we can be making at a policy level. And so anyway, happy to be here starting the dialogue and look forward to consulting with you on many other things going forward. Thank you.
Thank you so much, Libby. Very honored to have you join us today and appreciate your remarks. Yesterday, we were really excited to welcome to ACF a new director of the Office of Child Care, Dr. Ruth Friedman. And today's her second day, but we're really excited that she's been able to join us for this consultation. She was previously a child and family policy consultant, including working as a senior advisor to ACF's Office of Head Start on the development of the Head Start Early Learning Outcomes Framework and the overhaul of the Head Start program performance standards. Dr. Friedman has served as the executive director of the National Child Abuse Coalition and previously was the director of education policy at the U.S. House of Representatives Committee on Education and Labor, where she led numerous early childhood initiatives, including the 2007 Head Start reauthorization, plus childcare, pre-K, and home visiting legislation. And she helped lead efforts to improve TANF, juvenile justice, and child abuse prevention policies. So I am really excited that we have Ruth here, and I'm going to turn it over to her to welcome you all and share some of her insights. Ruth?
Thanks, Katie. Greetings, everyone. I am so pleased to be here. As Katie mentioned, I joined the Biden administration a day and a half ago. So forgive me for my newness. I'm learning as quickly as I can, but I was so pleased to see that this was on the calendar today, and I want to welcome you on the behalf of the Office of Child Care to this tribal consultation session. I'm happy to have the honor to hear from tribal leaders about your concerns and ideas regarding the development of the 2023-25 preprint. As you may know, it is the application tribes use to apply for the CCDF funds. Obviously, in the past year, there has been many exciting things going on to try to bring new resources to the issue of childcare so that we collectively are all helping meet the needs of children and families in the way that they need. And I don't want to go over, both Libby and Katie talked about some of the investments over the COVID year in childcare that have gone to the tribes. I don't want to be redundant, but you know, the bulk of the American Rescue Plan funds were appropriated by Congress on March 11th and are already available. This includes nearly $15 billion total for additional CCDF discretionary funding. That money is meant to strengthen the childcare system and ensure families have access to high quality, affordable childcare during and after the pandemic. This can be used for regular CCDF activities, including increasing payment rates, increasing wages and benefits for the workforce, and building the supply of childcare, which I know is a challenge in many communities. ACF was also awarded an additional $24 billion for stabilization grants to support childcare providers facing closure from decreased enrollment and increased expenses due to the COVID pandemic. This has been a really difficult year for the sector as well as for the children and families the childcare sector has been trying to serve. So we're really glad about these funds and really think they can leverage support for the sector in a way I think we long have hoped for. And then finally, Congress increased the amount of CCDF mandatory funds available for tribes, an almost doubling of this funding stream from 58 million to 100 million. This is a permanent increase that will be maintained even after the pandemic. So all put together, this is, I think, a historic moment for funding of childcare, which brings us back to the development of the 23-25 CCDF Tribal Plan Preprint. Currently, the preprint consists of 7 sections. We are going to go over those today, reviewing each section and providing time for testimony, comments, and questions. You can use the chat box to add your comments as well. And then before I turn things over to Jim, I have been asked to just quickly review the living agenda, which is flexible based on tribal testimony today. But our goal here is to move into tribal testimony from leaders, and in particular pertaining to the 7 sections of the CCDF Tribal Plan, which are to define the CCDF leadership and coordination with relevant systems. Second, to establish standards and monitoring processes to ensure the health and safety of childcare settings. Third, supporting continuous quality improvement. Fourth, provide stable childcare financial assistance to families. Fifth, ensure equal access to high quality childcare for low income children, and to promote family engagement through outreach and consumer education. And then hopefully around 3:45, we will turn to a discussion of CCDF tribal allocation size and move on to closing comments. So before I wrap up, let me just say that I hope this is the first in many meetings in which we are able to do this sort of consultation, and I am able to learn from you, and I am really looking forward to a productive relationship moving forward. Now I would like to open the consultation session, and let me hand it to Jim for that.
All right, thank you. So we're going to start off first by allowing tribal leaders to present any prepared testimony, and we're going to be using the tribal protocol that was mentioned earlier, starting with the top elected officials, the tribal president, chair, governor, etc., and going down the line. And then once we hear from folks who have prepared testimony, then we can go into a little more detail about the specific sections of the plan. And during that time, we'll also be opening up for additional suggestions and comments. So operator, do we have anyone in the queue who would like to provide testimony?
Let's see here. I'm looking for those who have raised their hands. And to raise your hand, if you hover in the Zoom screen, there is a button that should pop up that says reactions, and you can click on that. There's a little icon that says raise hand. So if you're in the Zoom room, feel free to do that. And right now we're looking for those who represent the first speaker role as serving as the tribal president, tribal chairperson, tribal governor. And if you're on the audio line, feel free to unmute. You can press *6 to unmute if you're on the audio line. Jim, I don't see anyone who has raised their hand yet, so just wanted to invite anyone who is in the speaker role of serving as the tribal president, tribal chairperson, tribal governor, or similar title. If you would like to come off mute, and feel free to share your video as well, and provide any initial prepared testimony. Okay, I'm not hearing any on that role, Jim.
Okay, that's fine. As indicated, throughout the discussion, just raise your hand and we'll put you in the queue and open your mic and you can provide your comments as we're going through this process. So moving on to the next slide. And then the next slide. So we wanted to just give a little background for folks because we know there are a number of new individuals in new positions. So as indicated earlier, the CCDF plan is a tribe's application to apply for the block grant funds. And this is basically you telling us your story. How are you going to provide these services, include the assurances, and these are required by law to be submitted every 3 years. And the plan itself can be used as a planning document because it's a living document. You collaborate, coordinate with numerous partners, stakeholders. The needs of the family and children may change, so you want to be able to update those as needed. So tribes can always submit a plan amendment when making any substantial changes to that document. Next slide. As indicated, there are currently 7 sections in the plan preprint, and we're going to go over each of those sections to obtain input on what was working, where you had challenges, where you think we could improve on areas. Again, we're looking forward to hearing from you about your experiences with the plan preprint. Next slide. As most of you know, the funding is determined by the child count that you submit. And when we're developing the formula, we look at the total number of tribes and the total number of children. And that's how your allocations are based. And then we take into the calculation the total dollars amount available. One thing about the child count is that the program is for Indian children. And to include Indian children, some tribes only include those within their reservation, their enrolled members, or those that can be enrolled. Other tribes open it up to all federally recognized tribes within their service area. So there's that additional flexibility. And then with the service area, it must be on or near the reservation. In the states of Alaska, California, and Oklahoma, there's additional flexibility because of the issues with the reservation land base. The other thing that we wanted to remind folks about is unduplicated child counts. Sometimes you have neighboring tribes and they're providing services in the same service area. So what we need to advise folks is that you need to compare your child count data to make sure that you're not servicing the same children. And we will be issuing a program instructions next year, late winter, early springs, because the counts will be due the same time the plans are due, July 1 of next year. Next slide, please.
Hey, Jim, before you go on, this is Dawn. There's a couple things in the chat. So one, someone is asking if written testimony can be submitted at a later date. And I know we have the address for submitting that later. So I just wanted to acknowledge that comment in the chat. And then the other one is, I think that we invited the tribal leaders to provide written testimony, but I don't know if we went down the rest of the list. And so I think there was someone in a vice chair role who might have been looking to provide testimony.
Okay, great. So Melody can look in the queue to see if that person's there. And if anybody else who's an elected official wants to provide testimony, go ahead and raise your hand, and then we can open up your mic. But regarding the written comments, just the comment period will be open for 45 days. And we have the email address that we can, it's actually in the slides near the end, but that is, in case you get disconnected, it's OCCtribal@indian.gov. acf.hhs.gov. So you can provide written comments during that 45-day comment period. So Melody, do we have folks in the queue who would like to present their testimony?
Yes, I believe Vice Chairman said that they're going to wait for a particular section to provide their testimony. So I think they'll wait till the next opportunity.
Okay. Did we have anybody else in the queue at this time?
I don't see any other hands raised at this moment.
All right. And as always, you can put your questions in the chat. We have folks monitoring that. And if you have comments as we're going through the section, you can also add those into the chat because this is our official record of all the consultation comments that we receive. And we will be using this as we develop the plan preprint. So moving on to the next slide. The other thing that we wanted to remind folks about is with the reauthorization a couple of years ago, the Office of Child Care made a decision that we would use a tiered approach to tribal requirements. And the reasoning behind this is that prior to this change, you know, everybody tried to fit everything into a square box. And because of the funding levels of our tribes, you know, we had some very small tribes that received about $30,000. And we had some very large tribes that received millions of dollars. So in coming up with this approach, we broke it down into tribes with small allocation, those tribes that received less than $250,000. The medium-sized allocation is $250,000 up to $1 million. And then tribes with large allocations is over $1 million. Now, based on those tribal sizes, there are different requirements. The small allocation tribes had a lot of flexibility, and a lot of the requirements didn't apply to them because, in part, their funding was so low that it would be almost impossible to have a operated program that, for example, a large tribe would be able to do. For the medium tribes, those requirements increase some, and then for the large tribes, they need to meet all of those requirements. And we'll be coming back to this topic as we near the end of the session to talk about the allocation size. So we'll be looking forward to hearing your comments about that. Next slide, please. Okay, now we're getting into the meat and potatoes. So part one of the plan preprint talked about defining CCDF leadership and coordination with relevant systems. Now, this is basically telling us about your administrative capabilities, who's going to be administering the program, talking about are you going to be operating the program through contracts or agreements. It talks about your consultation with folks, your different partners on the development of this plan. It also includes the Indian child counts and your definition of Indian reservation or service area. It also asks about coordination of services. You know, once all this comes together, how are you going to coordinate these services to provide care for your children and families that are seeking the services? And then finally, it talks about program integrity and accountability. You know, how are you keeping track of these dollars? What type of systems do you have in place? So next slide, please. So we wanted to hear from folks, you know, some of their comments regarding question one. You know, the information that we ask, is that helpful? Can it be improved? Are there questions about understanding what is being asked? Are there areas that are problematic for you? So we're going to open it up to hear from folks. Melody?
All right, thanks, Tim. So again, anyone who would like to provide a testimony and specifically to this section, but also if you would like to provide initial testimony, this is an opportunity. If you would like to make sure that we have you unmuted, you can click on the raise your hand button in the Zoom room. Just click on the reactions button and click on raise your hand, and we will see that and we'll be able to identify you. And we're going to ask that as you prepare to speak, we're just asking that you please share your name, your title, and the tribal nation or tribal organization that you represent. And Jim, right now I don't see any hands raised, but I do know that we had a couple. Oh, we do have a hand raised. So I'm going to go ahead and open it up to Michelle Moore.
Hi, my name's Michelle Moore. I'm the Social Services Director for Cow Creek Band of Umpqua Tribe of Indians. And one of the things that I've discussed with our grant manager and with CCDF in general is the use of these funds outside of the service area. We're a service area tribe, and I know that federally, we're asked to contact other tribes in other states or outside of our service area, and have not been successful. I have families in 15 states and have not yet been successful with accessing these services for those members. And so I don't know if there's been any discussion about that, or if we put into our plan that we can use these funds outside of the service area as long as we're using the our plan. And I probably should add that our plan, we don't use these funds for a child care. We use these funds for individuals and work with state certified child care providers. That would be that would be my question is it possible to put into our plan that we can use these funds outside of our service area?
So that's a great question. And currently, tribes identify their service area and they provide services within that service area. We have had instances where a tribal member who is living on the service area perhaps goes away to school, and because their residence is on the reservation, some tribes have put in their plan that that's one way they're going to provide services. But I think as we're moving forward, that's something we'll put on our list to discuss and talk about. One of the things that I'm hearing across the country is, what does a new child care system look like? We've been doing this for years and years and years. So how do we improve on that system? So that's a great question. We'll add it to our list for discussion. And most likely we'll be having additional conversations on this. So thank you, Vice Chair.
Okay, and I appreciate that. It's something we've been requesting for some time. And I think I should just add that when we do our population count, we do not, we just count our own tribal members. We don't use the census, or we don't use our service area for the count. And so our intention would be just to use the funding for our own tribal members. Which I think kind of makes a difference, because if you use the census or your service area for population count, then you're serving, any tribal members in your area. So that's kind of limiting for us. Thank you.
Great.
I appreciate it.
All right. Thank you for providing that additional information. And as I said, the session is being recorded and we do have note takers. So this is really valuable. Thank you. Melody, do we have anyone else in the queue?
I don't see any other. Oh, yes, we do. We have 2 raised hands. we'll go ahead and the first one that I see is Birdie Trainer. Go ahead and turn it over to you.
Hello?
Hello.
Hi.
Can you hear me? Hi, I'm trying to
hear
put
you.
in. Okay, I think the notes entered kind of clumsily into the chat there, but I'll go ahead and go through them. So some of the points we wanted to bring up were that tribal lead agencies, and my name is Birdie Trainer with Queric Incorporated in Nome. Tribal lead agencies operate under PL 102477 to be able to carry funds forward in perpetuity without the requirements to obligate and liquidate within a certain set period. Tribal lead agencies operate under PL 102477 should also be exempt from the requirements to use construction funds within a set fiscal period, and instead use them as the tribe deems fit when the tribe deems appropriate. Tribal lead agencies need the flexibility to define family and determine who is appropriate to serve as a relative provider within the bounds of their service areas. This definition varies widely. We would like to see written guidance from the Office of Child Care about placing standards and monitoring practices into code, law, or resolution. There seems to be a need for more understanding in that area. Tribal lead agencies should have the flexibility to determine what health and safety standards are appropriate and applicable to the children and families they serve. Further guidance and clarity should be issued around criminal background checks and alternative monitoring strategies. I know there's been a lot of wrestling with access to the background checks. Tribal lead agencies should be given further flexibility related to barrier crimes and appeals processes related to comprehensive background checks. Consumer education requirements for tribal lead agencies are culturally inappropriate. The majority of tribal providers are elders, grandparents, great-grandparents, and culture bearers. Providing a rating or consumer education statement on our elders does little to honor their contribution to the community. It is an undue burden on families with limited housing for the relative provider's sibling to reside outside the residence of care. And we would like to request additional technical assistance specific to Alaska and PL 102477. Thank you.
All right, great. That's a long laundry list. Some of them, I think, there's already additional flexibility. As you indicated, the 477 tribes can carry forward their funds without any requirements regarding liquidation and obligation. And regarding construction, we have been working with the Bureau of Indian Affairs because what we've been able to do is that if a tribe is going to request construction, and again, this lines up with the obligation liquidation period, as long as the Bureau of Indian Affairs approves it, going beyond that time frame, it's not going to be issued. The tribes just need to complete their application and send it to the Office of Child Care so we can review it and approve it. The thing about definition of family, this has been brought up since the program began because Congress set this definition, and because that's in the law, we can't make any changes on that law the way it's written. And I know what some tribal organizations and tribes have been doing is just approaching Congress to educate them about that definition and how it is in conflict with tribal traditions. Written guidance regarding standards and monitoring, etc. That's one of the things I believe we have on our list for the upcoming year is providing additional technical assistance around standards, around monitoring. And again, there's a lot of flexibility there to meet the needs of the tribe. So what kind of standards are you going to be looking at? And then how are you going to be providing training for individuals to meet those standards? And sometimes I think it's too easy just to say, okay, we'll just use the state standards. And those standards a lot of times are not applicable to tribes. And one thing, as we're moving forward, this would be an area I think all tribes could look at capacity building. You know, everybody has this extra funding, and how can you build capacity internally, for example, developing your standards to meet your particular needs. So again, there's a lot of flexibility there, but we do have this as a topic that will be addressed in technical assistance as we move forward. And that ties to the health and safety standards, training, etc. And as everybody knows, tribes, territories, and state, it has just been a challenge with the criminal background checks. And part of the issue that we understand with tribes is that tribes don't have the authority to conduct those checks, whereas the state does. So again, we're looking at different flexibilities, different options, and that most likely is going to be a continued topic as we move forward. So thank you. These are very helpful. And as Dawn indicated earlier, you know, we understand the differences with the 477 tribes and the additional flexibility that's allowed there. So again, thank you for those comments.
Thank you.
Melody,
And
did you
Jim?
have others? Yes.
Yes, we do. We do have the next one that has their hand raised is Vice Chairwoman Lonnie Greninger. And so I'll go ahead and turn it over to you.
Great, thank you so much. Good morning over here, at least in my region of Washington State, and just thank you for the opportunity to be able to speak with you today. I'm Vice Chairwoman Lonnie Greninger of the Jamestown Squalum Tribe located in Sequim, Washington. And the issue I wanted to address today is about the child counts. I would say that this particular issue has been a growing frustration for me as the CCDF administrator within our social services division here at the tribe. And there's two main issues that I would like to bring to your attention today. The first is that the tribal lead agency service areas, they cannot overlap. And for Jamestown, that poses a potentially awkward and very limiting factor for us. And I do want to put out there that, you know, I'm only speaking for Jamestown. I don't want to speak for my sister tribes, both Lower Elwha and Port Gamble Squalum, and they might disagree with me on this. But what I want to be able to bring to your attention is that our tribes, we used to be one nation historically, and then we were politically split up as the state government and the federal government came to be. So now we are three distinct sovereign nations, but we have a lot of cultural, traditional, and family ties amongst our three reservations, and we're closely located together. You know, actually Jamestown is in the middle. You know, there's a 45-minute drive between, you know, us and Port Gamble and then us and Lower Elwha. And with these, you know, intermarrying families, you know, we end up serving families and children in most of our tribes. You know, we have intermarriages with both. So it might be that there is a child that's in our after school and childcare program for half a year, and then maybe the other half of the year they go to Lower Elwha's. And I just don't want our service areas overlapping to be a limiting factor when both tribes are essentially serving the one family. And does that mean I'm suggesting that we double count children? Well, I guess in a way, yes. But we are equally serving these families, and I don't want to feel limited in that. It limits our child counts. I'm using hard dollars to pay for children that I want to be able to pay for with the CCDF grant. But I just want to be able to open up that door for discussion with the OCC, because I don't want to have any other tribes who are in the same position, closely located with intermarried families, serving, both serving one family, to have any limitations in our funding over that. The next piece of it is the data sources for the child count are not helping the Jamestown Squalum community very well at all. And there's a couple of ones that I wanted to highlight. The census data has historically been inaccurate. A lot of it has to do with not counting Indian communities very well on the federal side, but also we have individual Native Americans who are just fearful of putting their demographic information out there. So it's always been historically undercounted. We all know this across Indian country. What's been nice is, 2020, we had the great push to do better jobs within our own communities on getting our census data counted. But with this latest grant, I had to submit my child care. We all had to submit child counts in 2019. So now I don't get to use the updated data, which could have really helped our community. We're so small. You know, I only have an enrollment base of 535 right now. So any data that I'm losing is a cut to my funding, and that makes it so that I can't serve my people to the best of my ability. The next option that I've been told to gather data from is from our Office of the Superintendent of Public Instruction. But again, always undercounted there as well. I have parents who don't see a benefit in telling the school district that their child is Native. And so we don't get our students counted there either. My own enrollment data would not help me as far as the service base that I have, because we're small. Our number of citizens that are children and descendants are small, but we serve more than Jamestown children. We serve Elwha, Port Gamble, and any other Native that's in our service area. So just looking at my own enrollment data is not going to work either. And then the last one that I've been told to look into is IHS population data. But again, it also undercounts because our IHS data only talks about those who are being served within our health clinic only. It's not talking about those who seek doctor and medical help elsewhere. So I would just like the OCC to come together with tribes to discuss the best possible ways that we can have a child count, making sure that we're not limiting tribes. Yes, even when we're maybe possibly double counting children. But anyways, I want to bring that to the attention of the OCC and leadership here today, and just very grateful, raise my hands to you and all that you do to work for us here in Indian Country. Thank you.
Thank you, Vice Chair. I think the easiest one to answer is really regarding the data source for your child count. You know, the child count, it's a self-certification. And so you can use any data source that you like. We have heard that some tribes actually go around and count every child because it's their data, it's their information. Some tribes use a combination of Indian Health Service, Census, public schools, etc. And based on you know what's the number of children within your service area, then you come up with that particular count. Another tip I would give regarding multiple service areas with multiple tribes, we do have some tribes that, because of their close proximity, they actually get together and meet as a group to decide what their counts are going to be and which children they're going to be servicing, so that they then don't have a duplication of counts. But because their service areas are so close, there is some overlapping, but they have a clear understanding of who's going to be servicing which children. So that's on our list, and I think that's one area we can also look at. I know in the past we've had some TA sessions on this, and we can continue the discussion and see how we can move forward so you can have better counts to provide the services to those children that you would like to provide services to. So thank you for those comments. Those were great. Melody, do we have anybody else in the queue?
Jim, I don't see anyone else that has their hand raised at this time.
All
I'll
right.
just go ahead and, yeah, go ahead.
Let's move on to the next slide. Okay, part 2 currently talks about establishing standards, monitoring processes to ensure the health and safety of child care settings. And we know with the passage of the reauthorization, there's been a lot of questions about standards. How do they relate to training, monitoring and enforcement, criminal background checks, and even disaster preparedness. And I think with the current pandemic, folks really saw the need to be prepared for disasters and have some kind of plan in place. Next slide. So the health and safety standards for CCDF, there are 11 of them, and a tribe can define what these standards are. Some tribes just go to caring for our children and pull information on each of the standards. Others use the state information on standards. We have some tribes that actually have a combination. They have some tribal specific standards, and then they pull information from other resources. And then once you have the standard developed, then we can move on to the next slide, please. We're going to be looking at training, so what kind of training is going to be involved. We're looking at the pre-service or the orientation. And I know folks get confused when we say pre-service or orientation because sometimes individuals think that's two different folks. So
Hello?
I heard somebody join us.
This
Hello?
is Deborah Daniels.
Yes?
Hi. Okay.
Hello? I think you're not on mute. Deborah? Okay, we're sorry about that. So again, talking about the training, is it appropriate for the provider setting, the age of the child, and addressing those health and safety requirements, including child development. Next slide, please. Monitoring enforcement policies and practices for CCDF providers. Okay, what do you actually have in place to ensure that monitoring is taking place? I know one thing we heard from tribes, there were some concerns initially about, because folks, when they're doing unannounced visits, it might not be a safe environment. So folks, the child care folks, will need to take 2 staff with them instead of going alone. So you need to think about those things when you're doing the monitoring visit. But what kind of procedures do you have in place to actually address this? You're not there to be like the child care police that says, okay, you're doing this wrong, I'm turning you into Child Protective Services. But, how do you approach this in a way that's sensitive to tribal families that you're providing those services for? Also looking at an alternative approach. If a traditional monitoring approach doesn't work, what would be an alternative? And here we have a lot of tribes using tribal culture, ways of communicating with elders, parents, etc., to develop a system that's going to ensure that the lead agencies are able to actually monitor those particular sites. Next slide, please. Criminal background check. As indicated before, there's a lot of confusion about this. One thing that we noticed is that when the plan came out 3 years ago, there was a lot in the questions. A question may have actually had 4 or 5 questions within that question, and it made it very difficult to provide a response. So that's one area that we're looking at right now with that, is how to streamline those questions so that we're direct and to the point, and that it's easier to understand what is being requested. And I think this is one area that we'd like to hear from the tribal leaders, some of the challenges that have been faced with the criminal background checks. And I think we have one more slide. This slide here is just a high-level overview of the health and safety requirements as it relates to CCDF. And off to the left, you can see the health and safety training, the monitoring, and the criminal background checks. At the top, you have the providers, the settings, and the individuals. And the little colored boxes just indicate where an action needs to take place. For example, with criminal background check, that goes across the board. So you need to have policies in place to address all those. Whereas when you're looking at monitoring, the annual monitoring, there's different types of monitoring. There's the annual monitoring, the pre-inspection, the post-results of monitoring. So this is just a quick chart to give you a high-level overview because there's so many different players here. Next slide. So here's where we'll open it up to hear from you about some of your concerns that you've had with this particular section. Was there anything that was helpful? Where could we make improvements? Did you understand the questions? What was problematic? Are there other barriers that was a challenge in meeting those criminal background checks? And given the different standards and authorities tribe work with, how can we make this section easier to complete? So Melody, let's see if we have folks that want to provide testimony.
Yes, we have one person that has their hand raised so far, Julia Anderson.
I'm sorry, mine wasn't related to the criminal background checks, even though that was kind of a hard area to complete this last plan session. But mine was related to the health and safety standards and the limited space that we had available to complete that section. It was very hard, especially if you're working with multiple standards. Like because we're in a rural area, we work with both state licensed, tribally certified, relative providers. So we had different standards for each type of care, and trying to fit that all in the limited boxes that we were given was very difficult. We've had to put some of our standards in the identified box and then move the rest of the standards to a different area where we didn't have as much comment on. So that was really hard to do.
Okay, thank you for that comment. And we have some good news. We are actually working on an online system where tribes will be able to submit their plan preprint. It's taken over 20 years to get to this point, so we're very excited about that. Last year, we did try a different approach with a fillable PDF, and we found that there was a lot of challenges with that. So we're not going to be using that PDF format, and we're looking forward to the online system, which will actually have more space for people to provide their information. So that's the good news. So thank you for sharing those comments. Melody, do we have any others?
Let's see, I don't see any other hands raised, but just wanted to remind anyone who would like to provide testimony, if you could just use the reactions button on the bottom part of the Zoom screen and click on raise your hand, and we'll be able to make sure that you get a chance to provide your testimony. Jim, I don't see any other hands raised at the time.
Okay, let's move on to the next slide. And just to remind folks that if you're shy, you can always type in the chat box your comments or suggestions, because this is our official record that we're going to use as we develop the plan preprint. So our next slide is part 3, supporting continuous quality improvement. This section includes the goals and activities, quality activities for childcare, supporting training and professional development of childcare workforce, building a supply of high quality care, and funding quality activities. And one thing I forgot to mention earlier, you'll notice in the slides that most likely at the right-hand side bottom, there's a little box that says applies to all tribes. And as we're moving through, as we get later into the session, you'll notice that some of the sections only apply to those tribes with medium and large allocations. Next slide, please. So to focus on quality improvement, with the passage of reauthorization, there was actually additional language in the law that talked about a percentage of funds that needed to be spent on quality activities. For FY 2022, it's 9% for quality, 3% for infant and toddlers. For the small allocation tribes, they are not required to spend funds on infant and toddlers, so theirs is at 9% across the board. And then for medium and large tribes, it's at 12%. And remember, these are the minimum standards, okay? You can spend more if you have those additional resources. Next slide, please. These are the allowable quality activities. And what we've noticed in the prior plan was that a lot of folks just went to other measurable quality activities and added tribal specific activities, or they went to the one that said cultural activities. But really, in all of these activities, you can incorporate some type of cultural practices. For example, in their infant and toddler, you can incorporate the use of cradle boards. You can incorporate the use of language for young ones. Another area that folks can look at is when you're talking about program standards, developing your particular standards. You could also use this to help build on your health and safety standards, even under quality evaluation. What would you like to evaluate within your community? A lot of times we hear folks talk about we need data, 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 but locally, what type of data do you need and how would you use that information? Next slide, please. Okay, so I think we lost the slide that said ask questions. So let's back up one, and do we have questions regarding the quality activities? Melody, do we have folks in the queue?
I don't see anyone with their hand raised at the moment, but I do want to just remind everyone that to provide testimony, please use the raise your hand button. It's under the reactions button in the Zoom room. And just click on raise your hand and we'll be able to see your name pop up, and then we can call on you to provide your comments or your questions on the part 3.
Great, Melody. And also, just to remind folks, with all of the supplemental funds, there's some additional flexibility that's available regarding quality. So for example, with the CURSA funds, there is not a limitation on the quality or the direct services. So again, because of the increase in funding, there's also increase in flexibility on those types of services that you can provide. So let's move on to the next section. Providing stable childcare, financial assistance to families. Now this is a unique opportunity and flexibility of the program. Small allocation tribes really have no requirements under this section. But as we discussed 3 years ago, what kind of information would be of value for the Office of Child Care for those small allocation tribes who may be providing direct services? So we looked at it, we stepped back and took a look at it, and we decided, well, some very just basic information. So number one, identify, are you a small allocation tribe? And then the types of care provided if you're going to be providing those direct services. And this is really simple. We didn't ask you to go into detail to explain each of those. You just indicate, what kind of care you're providing. And then how much or how does the tribal lead agency fund its direct child care services? Are you using certificates, grants, contracts? And again, you didn't need to go into great detail, but just indicate, how are you doing this? And then talk about your eligibility process, the age of children, family income size, reason for care, oops, a typo there, and priorities for the vulnerable population. And as you move forward in the plan, you'll notice there is a section that talks about eligibility, and there are many, many, many questions in that section. You don't need to go to that section and provide a response to all of those questions. All we want in this particular section is, again, tell us your story as a small allocation tribe, how you're just determining your eligibility. Same thing with describing how parents apply for child care services. Again, what is the process? And then attach a copy of your sliding fee scale, with the effective date and then attach a copy of your payment rate. And as we look at developing this section again, we're going to, consider that, there currently are no eligibility requirements, but what information would be of value for tribes to share with the Office of Child Care about how they provide direct services as a small allocation tribe. Do we have any comments or questions or suggestions? I think we can go to the next slide too.
Jim, I don't see anyone with their hand raised at this time.
Okay. And as always, you can drop your comments into the chat. Okay, the next slide.
And Jim, this is Dawn, and I know you touched on this a little bit, but I will just kind of emphasize, and I'll put the web link in the chat as well, but there's, the question about the different services with COVID funding and the different COVID CCDF funding. And, each bill that has passed since March of 2020, starting with the CARES Act, and then going to the CRSA Act that passed in December, and now the American Rescue Plan that passed in March of this year, each one of those laws has had different requirements around the funds. So while they're all supplemental CCDF funds, there's different uses and different things that are allowed under them. So my best recommendation to everyone is to use the OCC website, where we're posting the guidance, and we're also posting FAQs for all of the funding, because and we will continue to provide TA and information webinars, etc. But I encourage all of you to kind of use the guidance that is being put out, because each one of those is a little bit different, and we recognize it too. And so those guidance documents are the best pathway we have for kind of talking about the different services that are allowed with that different funding. So again, I'll put the web link in the chat, but I wanted to just kind of say that out loud before kind of typing all of that in the chat.
Great, thank you, Dawn. Okay, let's move to the next slide. Okay, part 5, ensuring equal access to high quality childcare for low income children. And here is where you're actually providing a description of those direct childcare services, assessing childcare market rates, setting payment rates for childcare services, payment practices and timelines of payment to providers, and then family contribution. And you'll notice that as we move forward, this section only applies to medium and large allocation tribes. So for the small allocation tribes, their application is actually complete once they make a decision regarding Section 4. So next slide, please. Okay, the CCDF categories are of care. There's center-based, which is a center or tribally operated center. Family child care homes, where the care is provided in a private residence other than the child's home. And then we have in-home child care, where the care is provided within that child's home. Next slide. Market rate survey or alternative methodology. Again, this is one of the flexibilities of the program for tribes. Tribes are exempt from conducting a market rate survey. However, tribes with medium and large allocations are still required to have adequate payment rates that support their quality. Next slide. Okay, we'll open it up to questions. So for this section, and if you can go back to part 5, one more back there. Did folks have any comments or suggestions on this section? What worked, what didn't work? where you needed more information, etc. Melody, do we have any folks in the queue?
I don't see anyone with their hands raised right now. Just wanted to remind everyone on the line, just use the little reactions button to raise your hand if you'd like to make a verbal comment, or you can share in the chat box on part 5.
Okay, let's go on to the next slide. Part 6, promoting family engagement through outreach and consumer education. This section talks about the parental complaint process, consumer education for parent providers and the public, additional consumer and provider education, procedures for providing information on developmental screening, and consumer statement for parents receiving CCDF. And so we're looking for comments on this. I know earlier we had some comments regarding the consumer education, consumer statement, etc. But as you provide these tools for the families that you're servicing, you can develop it and embed your traditions and cultures into these activities. You know, I think we heard an earlier comment about elders, you know, and it being disrespectful for elders. But I believe there's a way tribes can address this requirement, but put additional emphasis on your own traditions and cultural activities to be able to inform families, providers, and the public about the services that you're providing. And again, I think this is one area that we're looking at providing additional technical assistance just because we've heard similar comments in the past. Melody, did we have any folks in the queue at this point?
No, I don't see anyone with their hands raised at this time.
Okay, let's move on to part 7. Consumer education for parents, providers, and the public. Again, within this section is how are the tribal lead agencies addressing how information is given out to child care and other entities that support the availability for eligible children. We've looked at some things that talk about research and best practices concerning child development. What kind of policies do you have in place regarding social and emotional development? And in this section, tribes are exempt from actually providing a consumer website page. Next slide, please. So when we're talking about developmental screening, here's some just basic bullets that we thought we would share with folks. Is information on social emotional behavior from birth to school age. Provide information on existing resources and services within the community on conducting child development and screening, referrals, description for families on how to use these resources, require resources about developmental screening, be provided during the actual intake process so that parents are aware of the information, and recommend that, but it's not required, all children receive a developmental screening within 45 days of enrollment. Next slide, please. The consumer statement. Again, to provide information on subsidies, how they're designed to promote equal access, how to submit a complaint through some kind of hotline, and how to contact local R&R or other community-based support. And that's for the general information. And then provider-specific is regarding health and safety, license, regulatory requirements to be met by the provider, date of last inspection, voluntary quality standards if they're met by the provider. Next slide, please. And again, a lot of this is how do you get information to the parents and families so they can make informed decisions. So in this particular section, what was helpful? Where do you think we could make improvements? Were the questions understandable? What were some of the problematic areas? Melody, do we have any folks in the queue?
Jim, I don't see anyone with their hands raised at this time, and just want to remind everyone, if you'd like to make a verbal comment, just use the reactions button on the bottom of your Zoom screen and click on raise hand so we can see your name pop up. And I don't see anyone right now.
All right, thank you, Melody. Next slide. So we're going to be shifting gears here, and we want to talk about the tribal allocation size. Currently, the allocation size are broken down by funding levels. Small allocation tribes are those that receive less than $250,000. Medium allocation is $250 to $1 million, and large allocations is over $1 million. And these were determined using the FY 2016 CCDF final allocations table. Next slide, please. So as you can see, based on this chart, there's been a dramatic increase in just regular CCDF. This does not include any of the supplemental information. And when we're talking about the allocation size, we're not going to include any of the CCDF supplemental funding because it's not forever. It's like one-time funding. So this chart here just shows the dramatic increase in our regular CCDF funding. And as you can see, we're up to about $440 million just for tribes. That's just a regular funding. And way back in 2016, it was only about 137 million. So you can see the increase. And when we determined the allocation size, we used the FY 2016 funding level. Next slide, please. So as there have been dramatic increases in childcare across the board, one thing we're looking at and would like to hear your thoughts and input is for an updated allocation approach. We've identified two options, but we're also open to hearing from folks about other possible options. The first option, option one, is to increase the allocation cutoffs so that the same proportion of tribes are in each category. For example, tribes with small allocations, their level would increase to 725,000 instead of the 250,000, and vice versa for the medium and for the large tribes. Option two would be to increase the allocation size based on the average change of the allocation. In this case, tribes with small allocations of less than of 500,000 would fit in that group instead of the 250, and then it would move up. For the first allocation, a large percentage of our tribes are listed in the small allocation category, approximately 150, whereas a medium and large kind of even out around 70 each. So that's kind of sort of the proportion of those. So we wanted to hear from folks what their thoughts are. And if you like one or you like two, you could just put it in the chat. Or if folks have another option that they'd like to share with us, we would appreciate hearing what those options could be. Melody?
All right. So just wanted to remind everyone, for those of you who are on the phone, there are two options that Jim just went over. and also a third option if you have another idea. And just wanted to remind everyone to provide a verbal comment. Just click on the reactions button on the bottom of your Zoom screen and click on raise hand so we can see your name pop up. And if you would like to provide a written comment, you can feel free to type that into the chat box. And I'll go ahead and see if anyone would like to provide any initial thoughts on these options.
And if you have a preference, you can go ahead and just note that in the chat.
And Jim, I don't see any people with their hands raised at the time, but I know that we have quite a few tribal leaders and elected officials on the line.
Mm-hmm. Okay, great.
And Jim, we do
And
have
again,
some options coming in through the chat box.
yes, I've seen those. So as folks continue to type in the chat box, we'll take all the comments as we move forward and looking at any possible changes to those allocation sizes. Next slide, please. Okay, next slide. Okay, so we wanted to remind folks the public comment period is open for 45 days, and that will close on July 9th. And you can send in your written comments to occtribal@acf.hhs.gov. And I think at this point, again, we're going to open it up if anybody has additional testimony or comments or concerns that they'd like to share with everybody. Melody, let's see if we have any folks in the chat. I know there's been a lot of information that we've gone through.
Jim, we do have a third option proposed by Margaret Zintek. And we also have comment from Julia Anderson.
Mm-hmm.
And I don't see anyone with their hand raised at this time.
Okay. Yes, I'm reading the comments. Great. Okay, if we don't have any more comments, I know we're ahead of schedule. So I think Dawn's closing is going to be like 30 minutes or so. So I'll turn it over to Dawn, and people can continue to type your comments in the chat box. That is appreciated. Thank you. Dawn?
Yeah, thank you, Jim, and thank you to everyone who has been both speaking up and providing comments as well as chatting in the chat box. And as we said at the beginning, you know, we're holding this consultation under ACF, you know, tribal consultation policy with the tribal leaders and their designated representatives. So we know that we might have a few others who've joined us on the phone, and we will be glad to engage with others, you know, as well as get feedback. But I really want to thank the tribal leadership and representatives who've provided very helpful input throughout the process today. And I think I have a couple things that I would say kind of in closing as we move forward. And I'm glad that this public comment period is staying up here, because my comments, just to wrap us up. So definitely, as I said at the beginning, written comments are very helpful as well. You all have until July 9th to submit those in. Once the Office of Child Care receives the comments, both will have the record of the chat, but also those written comments. We will be taking a look at those and seeing how we can make adjustments in the plan preprint itself issues that kind of go beyond the preprint and are more policy level, just changes that might need to be made that don't fall within the scope of the program right now, we will be engaging ACF leadership and looking to see where we can find the flexibilities that we are hearing from you that would be helpful. So I want you to just have a sense of what's going to happen in terms of the comments from today, as well as the ones that come in prior to July 9th. And then in terms of the plan preprint, just to give you all a sense of direction on that as well, in order to have a plan preprint, so the actual form that you all will fill out, it's around a 6-month process that we have to go through to get approval on that document. So what's going to happen is a series of 3 steps, and I encourage you all to be on the lookout. And again, we will be sharing this information along the way as well. But what happens in terms of those 3 steps is the Office of Child Care will draft a plan preprint, and then in the Federal Register, there will be an announcement that says the Office of Child Care has developed a CCDF plan preprint, and that the preprint is open for a 60-day public comment period. And so as part of that public comment process, folks can submit feedback on the document itself. And so, I think our goal is to not reinvent the document that you all saw the last time, but we definitely want to make improvements too. So this is where the testimony from today and your written comments from that follow up to today will be helpful to make sure that we make the improvements where we can. So there will be that 60-day public comment period, and after that comment period closes, we'll take the feedback that comes in through the public comment process, and we will make revisions to the preprint. And then a second draft will be created. And that draft, there will be a notice that goes into the public, into the Federal Register, and there will be a 30-day comment period. And so those comments not only go to the Office of Child Care, but they go to the Office of Management and Budget that's part of the White House. And the Office of Management and Budget oversees the approval process for all government information collection forms. So after that 30-day public comment process, any comments that are received through that will come back to the Office of Child Care, and we will need to take a look to see if there are last adjustments we need to make to the form based on those final sets of comments. And then if there are adjustments we need to make, we'll make those. And then we wait for the Office of Management and Budget to give us final approval on the form. And so that's why collectively this takes around 6 months. And so in order for you all to have a preprint, a form that's available for you all to submit with your plans for July 1st in 2022, we're looking to start that public comment process by the end of this summer. So, end of August, beginning of September, so that the goal is to have an approved preprint that makes it through all of those public comment periods and revision steps. We would want to have that approved in early 2022 so that you have it available to you to use for your own public hearings and working with your partners, and be able to submit your next plan but by July 1st. So today is the first step of moving us towards that, closer to that, starting that 6-month process. But as everyone said at the beginning of the call, it's not the last step. And we really do look forward to engaging with all of you over the upcoming year, and being able to work with you all on not only helping, have good plans submitted next July, but also to be able to have your CCDF program meet the needs of the tribal children and families and providers in your community. So with that, I think I'm not going to take 30 minutes like Jim suggested. I was keeping an eye on the chat box though, just to see if there was any last things I might need to clarify based on what I was saying. But I think that we will take a record of what's in the chat. And I think with that, I'm going to wrap us up today. And thank you all once again for your helpful insights and feedback and your openness to sharing that input and feedback. And we look forward to continuing this conversation over the next year. So with that, I think we can say goodbye for today. So thank you.